interrupt my clients a lot. And maybe it's not empathetic or exactly what they're expecting from a therapist, but it's part of education to help them see what you're doing right now, that's going to cause you problems. Like the language you're using, that's limiting language. So I want to help people hear their limiting language so they can catch themselves when they're doing it outside of the room with me. So I will interrupt if they're doing a can't or a should or an ought or even an it. It makes me feel this way. Well, what's your it? Let's get clear. Let's not use a murky language. Let's understand what your it is. So I really like interrupt people a lot and say, can you say that again as an I statement instead of a you statement? I'm always jumping in, asking people to own themselves, to define things in a way that's solution focused, that's possible for change, and not boxing them into I can't. Or I think part of what makes it possible for me to do this kind of interrupting is that I'm a playful and engaging kind of therapist, and I'm not sure that all therapists would be that comfortable with interrupting. But I find with my personality and my style, it's really it's fun. It's part of how I do things, and I don't know that again I would prescribe this for everybody, but what I think is helpful also in interrupting is showing people that you can interrupt playfully, that you can disrupt what's happening in a way that actually is helpful. Like one of the examples I often use is the playground monitor, blowing the whistle. You know, it's like kind of mean to blow a whistle on kids on the playground. They're just having fun, but it's necessary to keep kids from getting injured. My job is to sort of blow the whistle and say, I'm going to keep you from injuring yourself by confronting the way you're talking to yourself. If I'm constantly jumping in on those things, they start doing it to themselves. It's not like they're relying on me. They can talk crappy everywhere until they get to therapy, and then they're going to be caught at it. My catching them helps teach them to catch themselves, and that's very, very helpful, that they start listening and hearing, oh my gosh, if I said that in therapy, I'd be caught. So I better right, what is the reason I'm not supposed to say that? And then I don't just catch them and tell them they're doing it wrong. I instruct them about how it limits them. How you define things confines things. So if I'm saying I'm always like this, I can't remember people's names. I'm not very good at that. How much effort am I going to put into trying to remember your name if that's my story about myself? So if I hear a client with a limiting story, remembering people's names is probably not one I'd interrupt, but if I did hear a limiting story, I'd remind them that they don't have to limit themselves. If they actually want to not be depressed, it's probably a good idea to not say, I'm depressed every morning. Probably doesn't help. Oh, it's very, very much like narrative therapy. What's the story you're writing? The other thing I think that's helpful is teaching them about confronting things, and that confronting things is possible to do. We think, oh, I can't confront, I'm not good at confronting. It's like, and I can model for them how to confront in a playful and engaging way that's not offensive, except maybe to some clients who are really soft-skinned or thin-skinned, and I'm sure for some people any kind of instruction about how they might be coming across could feel offensive, and so but most of my clients are tough enough, and I'm engaging enough, and I have a strong enough relationship with them before I start messing around with how they're. Sometimes I feel like I'm the word police, you know, constantly like helping them realize what they're saying and how they're defining themselves in a way that may be limiting them.